students, today we are going to do the previous year questions of NEET PG 2023. So coming to our first question in physiology, a transport system across cell membrane is given below. The process indicates which of the following? Well, the primary active transport involves the utilization of ATP, in which the ions, they are pumped across the membrane against their concentration gradient. So in this picture, we see that the ionic movement is happening along the concentration gradient. The secondary active transport occurs when the primary active transport has created the electrochemical gradient for one ion. For example, the sodium potassium ATPase pump, it creates the electrochemical gradient. By pumping out the sodium, it decreases the concentration of sodium inside the cell. So the another transporter, which could be a co-transporter or a counter transporter, means a symport or an antiport, which transports the sodium, and this sodium, it either brings along any other molecule with it, or it exchanges the other molecule with it. So this is the symport and this here is the antiport. So in either of these cases, this shows us the secondary active transport. In simple diffusion, the molecules, they simply move across the membrane along their concentration gradient, and it depends on the permeability of that molecule in that cell membrane. Next is the facilitated diffusion, in which the molecule needs a carrier protein to shuffle or to send the molecule across the cell membrane without the use of energy. It is based on the concentration gradient again. So out of these four choices, this particular diagram, it refers or it looks like the facilitated diffusion. Hence our answer here is D. Coming to our next question, this is a very interesting question, and this diagram is as it is there in our review of medical physiology by Genong. So you can read more about it from there. Well, I will try to make it a little simple for you. The clearance of subject X, Y and Z are studied on different concentration in blood. Match the correct answer to the following. Actually, this graph pertains to the plasma clearance of three substances in the urine. So here the plasma levels of the three substances, which are named as X, Y and Z, they are shown, and its clearance is also plotted against this. So we have three substances. One is X. So here X is the standard substance which is having a free filtration in the first pass itself from the kidney. So this X is inulin. Now here the concept is that we must have three things in mind. The first is the clearance of that substance labeled as C. So now we are talking about clearance of the substance Z, so we are going to call it as CZ. The plasma level of Z, we are going to call it as PZ, and the transport maximum of Z, we are going to call it as TMZ. So now we have to find out what is this substance Z. So here we can see that up to the transport maximum or the renal threshold, the substance Z is not getting filtered, it is not getting. So here in this diagram, we see that the substance Z is not appearing in the urine up till the renal threshold level. But once it crosses the renal threshold level, its appearance in the urine increases. So this means it has crossed the transport maximum also, and this kinetics is followed by one substance which you are quite familiar with, and that is glucose. So our substance Z is nothing else but glucose. Now coming to the third substance, well, it is quite clearly seen here also, but still we will see the kinetics. Now here we will call it as clearance of the substance Y, plasma level of substance Y, and transport maximum or renal threshold of the substance Y. So here we see that when the plasma level of substance Y is less, the clearance is very high. So as the plasma levels of substance Y are increasing, as it crosses its renal threshold and its transport maximum, its clearance decreases and it almost becomes close to the clearance of inulin. This substance is para-amino hippuric acid or PAHA. So now we know that our substance X is inulin. So we have two choices which tells us that the X is inulin. Our substance Y is PAHA, which is coming only in the choice A, and our substance Z is glucose. Hence the correct answer to this graph is A. A 32-year-old male patient, due to intravascular hemolysis, his serum potassium level is increased to 5.5 milliequivalents per liter. Again, reminding you of the normal potassium levels, which range between 3.5 to 5.5 milliequivalents per liter. What will happen to the resting membrane potential in this patient? So this is what we have discussed many times, that whenever the potassium levels they rise in the extracellular fluid, the permeability of the membrane to the potassium efflux decreases. So because of this decrease in the permeability, the levels of intracellular potassium increase. So because of the increased presence of the positively charged potassium ion, the cell membrane or the resting membrane potential becomes more positive. The cell will get depolarized, and hence the answer is A. In this question, we have, if a dorsal column is hit from the lateral side, which of the following fibers will get affected first? Now, it's a very interesting question. I would like to give you the overview that how the fibers are arranged in our spinal cord for the ascending tracts. So, as we move from the lumbar segment to the cervical segment, let's first talk about the lateral spinothalamic tract. Now these fibers, they will cross to the opposite side and ascend in the lateral lemniscus. When you move towards the thoracic segment, the fibers from the thoracic segment, let's take this with green. So now this green one is showing the fibers from the thoracic segment. They will be placed medially. Now the fibers from the cervical segment in the lateral spinothalamic tract, they will be present more medially. Hence we can say that the lateral spinothalamic tract, it is arranged in a way that your sacral fibers are on the outside or on the lateral side, then you have lumbar, thoracic and the cervical fibers present in the lateral spinothalamic tract. Whereas in the dorsal column, let's do this again. Whereas in the dorsal column, the fibers which are entering in the sacral segment, they are more medial. The fibers which are entering at the lumbar segments, they are more lateral. The fibers in the thoracic segment are even more lateral, and the fibers in the cervical segment are the one which are on the lateral side of the dorsal column. Hence, we can say that the fibers are arranged in a way that we have the sacral, lumbar, thoracic and cervical fibers arranged in this way in the dorsal column also. So the sacral fibers are most medial in the dorsal column and cervical fibers are most lateral in the dorsal column. So answering our question, if the dorsal column is hit from the lateral side, means from here, which of the following fibers will get affected first? You now know the answer. The answer here is A, that is the cervical fibers. So with that, we come to an end of this session. I hope you have had a good learning session with me. Keep learning with DigiNerve.